Cocaine causes a lot of problems. The two things that cocaine does is it causes euphoria, but it also can cause vasoconstriction, which means it can cause necrosis in areas of the nose. When you get necrosis of the mucosa that's covering the septum, that area becomes infected with bacteria, and your body doesn't have the ability to bring blood to that area to fight that infection. Patients usually solve that problem by picking at it, which causes further ulceration and your body trying to heal, which makes another scab. And then over sometimes a short period of time, you end up with a perforation. And then once the hole is there, it is self-feeding. So the air circulating, the mucus drying in there, the crusting, the continued use of cocaine feeds it, and the hole just gets bigger and bigger and bigger and bigger and bigger until a patient may see a saddling where the nose is collapsing. They may hear loud whistling noises. They may get crusting in the nose that becomes fetid or has a weird odor. And they may start having nasal pain as that perforation extends from the cartilage and starts working its way into the bone. And that becomes very painful. And patients who are alerted early with whistling and get evaluated early, they can avoid further habits that exacerbate their symptoms and make the perforation larger. Patients who come in later after really bad infections like with staph, sometimes, half of their cartilage is gone by the time they get evaluated. And it's very unfortunate because if patients wait too long, there's nothing that can be done to repair that septum. We're just looking at nasal reconstruction to try to stop their nose from collapsing at that point.